Hi, and welcome to today's presentation, How to Heal a Breaking Heart, a Man's Perspective. I'm so honored and grateful to have with me Thomas Dahlborg. And Tom is a father, a husband, a coach, and president and CEO of Dahlborg Health Caring Leadership Group. He has nearly 40 years of extensive healthcare leadership experience. He is a voice for relationship centered and compassionate care and servant leadership. Tom and his team position leaders to engage heart and mind in all they do so that they are well positioned to embrace and embody compassion, care, and love while leveraging science and evidence. And this helps them to honor their callings and achieve betterment for all. I love this so much, but before before I let you speak, there's more because you have such a juicy bio here. Tom is also an internationally recognized speaker and an award-winning writer and contributor of several books. Today, we're going to talk about your book, From Heart to Head and Back Again, A Journey Through the Healthcare System. Tom believes that at the end of the day, it's all about love and impact. Welcome, Tom.
Oh, thank you, Teresa. I've been looking forward to our discussion today and sharing and learning with you and your audience.
I cannot tell you how excited I am to have you here. You and I met. Actually, your son introduced us. He connected us, and when you and I met, it was as if we had mirror stories about our journey through the healthcare system. Most of the people who know me already know my story. So let's talk about your story. Let's begin by talking about your breaking heart and give us an overview of that experience.
Well, I have a number of memories from those times. It was back around 2000, 2001, and I was working in the military healthcare space. And I remember my bride at the time kept telling me, you got to take it easy, you got to take it easy. And I was about to get on another flight, and I get on this flight, and we're flying from Maine to Seattle. And on the flight, I couldn't breathe and I could barely make it to the restroom. And I remember being on that flight and the flight attendant just being incredibly caring and incredibly, you know, I was sweating. I looked awful because I was so sick. And she just took care of me. And it was like, wow, this is the way healthcare should be,
Mhm.
and it was a flight attendant on this flight. And so I get to these meetings, these military meetings out in Seattle, and I remember thank God they were in the same hotel that I was staying at. So I would be in bed all day, go down for a meeting, go back to bed, come down to a meeting, and couldn't breathe. And, every night I would pray, can I make it through the night? And, I would debate call 911 or just try to make it through. Long story short, I finally got home. I get rushed to the emergency room, and I remember being there and just being so lonely. And my bride was with me. We had a good friend that was watching our children. And I remember at one point, a doctor pulls back the curtain to the bay I was in the emergency room, and she looks at me and she says, "I know why you can't breathe. You got a broken nose." And then she closes the curtain and she's gone. Never saw her again.
Wow.
Long story short. So I ended up being diagnosed with viral myocarditis. I was having a heart issue this entire time. I remember going through that journey, trying to survive. I remember seeing specialists and going into the offices and being told, "Oh yeah, you have a heart attack." So it wasn't Tom or Thomas or Mr. Dahlborg or anything like that. I was now the heart attack. I wasn't a human being anymore. I was a diagnosis. I remember we saw, I think, 5 to 7 specialists within a short amount of time. And I was adding up the amount of time in totality, that I spent with these specialists. It was less than an hour between, and yet there was such goodness in the system too. I remember being in the hospital that first time and a transport aide calling me by name and not my diagnosis. I remember him talking to me and not at me. I remember him bringing me up to the floor I was about to stay at and telling me how good the nurses were, and then bringing a nurse over and saying, take care of Tom. It was really just
Wow.
goodness within this system. I remember that first night in the hospital, and I was, again, so alone and so dark, and my bride had to leave me to go be with our kids. And I remember this nurse coming in middle of the night, again, pitch black, and she sits on the edge of my bed and she holds my hand and she says 4 magic words to me. She says, Tom, I got you. And that's what got me through that first night, was I knew that Nurse Linda was there for me and I was going to survive. So those are a few of the highlights of that experience with my heart.
So that must have been, well, first of all, I want to go back to the broken nose. Do you have any idea why she said that to you?
I don't. I can only guess. To my knowledge, I've never broken my nose, but I have no idea. Maybe wrong patient, maybe looked at the wrong medical record, maybe those types of things, which is scary in and of itself.
Yes.
It was the communication. And then to just not introduce yourself, not to say, introduce, connect with me or my bride, anything like that. It was just one of those things that just stands out, unfortunately stands out.
Yeah. Yeah. And I get that, because I have had my own journey through the healthcare system, and I have such a high admiration for nurses, because they are the bridge between the patient and the doctor. And oftentimes they're the ones who will come to you and say, this is why Dr. So-and-so thought you had a broken nose. Their role is far more than administering blood work and things like that. So here you are. They've told you you have this heart condition. You've seen 5 to 7 specialists for a total of about 1 hour worth of information. This must have been incredibly frightening. Can you share with us what happened next?
Absolutely. So yeah, it was over time I saw those 5 to 7 specialists. And to your earlier point, I was really smart. I married a nurse. So that was, my bride is a nurse. She's brilliant and she's helpful and to be in the room and to share and to educate me as to what I was hearing throughout this ordeal. So I remember, again, being scared. First of all, I was like, I got this. I've been working in healthcare at that point, about 15 years. I knew the head of the cardiology department. I knew the CEO of the hospital. Teresa, it doesn't matter. It doesn't matter. When you're sick and you're getting sicker and you're tired and you're afraid, it doesn't matter. And I realized that any illness, I guess, but especially this type of illness and the cancers and so forth, these really life and death illnesses, they affect you holistically. When we're doing really well in healthcare, we talk about holistic health caring. I don't know if we always connect the dots to realize that there's a holistic impact on the patient themselves. So it's not just life and death. It's also, can I support my family? Am I going to be able to support my family? Are we going to be able to afford our house? Am I going to be able to walk out of a hospital? It was those types of things that were going through. And I, again, realized over time, after first being confident I could manage, to I have no idea, and being incredibly scared and relying on faith in many cases, but also having incredible arguments with God and losing every one of those arguments about what was happening and through that journey. So it was incredibly challenging, and it hit on every possible level: physical, mental, emotional, spiritual, financial, and we could just go on and on and on.
Yes, I understand that. I've had my own experience, and I find that in my practice, helping people become empowered patients and taking a holistic approach to their healthcare, and I mean holistic approach. Okay, the ones that do the best are either afraid of dying or impacting their family financially and becoming a burden to their family. Those are the people who really make progress quickly in my practice. So I get that completely. So what happened next?
Yeah, it was quite interesting to go through this journey again, thinking that I knew everything to I didn't have a clue
Yeah.
to oh yeah, I'm married to a nurse and my sister's a nurse and I have lots of relatives in the field and I've been working in this field and I've been trained in this field, not clinically but otherwise. You know, got to a point where my doctors, the healthcare system gave up on me. You know, they said there's no more that can be done for you. Get in line for a heart transplant. And then they sent me to a pain clinic. And I remember getting to that pain clinic, and this really nice physician uh, greets me, and he says, "Here you go." And I said, "What do you mean, here I go?" I said, "What's that?" He said, "This is your menu. It's your menu of narcotics. Where do you want to start?" And so this is again 2000, probably 2001 at that point. Uh, and we wonder why we have an opioid epidemic now. I mean, there's lots of reasons, there's lots of drivers for it, and how we managed pain then and even now is a large part of that. So there's that old saying, "There, but for the grace of God, go I." I mean, thank God I didn't go down certain pathways. And yeah, I remember not wanting to take the meds. And the doctor and I and my bride talked about it, and I finally agreed to take the first prescription. And it took me some time before I actually took it. And I remember taking it one morning all by myself, the first dose. And then my son, who you met, of course, and he was just little. And he comes down, and we're in the kitchen, and he says, "Daddy, I want some cereal." And I won't bore you with this long story, but I couldn't find the cereal, and I wasn't feeling right from the meds and so forth. And I yelled at my son. I yelled at this beautiful young child because he wanted cereal. And I remember running to our bathroom and locking the door and just totally losing it. Because at this point, it had been probably, I'm going to guess, maybe 11 to 12 months of
Wow.
trying to manage and going through the system and through that journey. And I just remember breaking down, and my bride comes running downstairs, and she's banging on the door, and she's talking to me and trying to calm me down. And I remember saying to her, I said, "I can't do it." She goes, "What can't you do?" And then at that point, we took the meds and we just flushed them. I said, "I'm not doing this. I will live in pain than be like this." And again, back to that old saying, I'm just glad it didn't go down a different path, and I'm glad it all worked out.
So here we are about 12 months in. The healthcare system has virtually given up on you. They've told you that you need a heart transplant. And the only thing they can offer you at this point is pain medication, which you have now experienced and made a conscious decision that this is not for me.
Right.
Okay. So you did set out on a journey to heal your broken heart. Could we explore that a little bit?
Absolutely. So at that point, as I noted, physically, mentally, emotionally, spiritually, I was done. I was absolutely done. All I knew is I wanted to somehow survive for my family. But I also did, to your point earlier, I didn't want to be a burden for my family. And so we had been, my bride's a nurse, as I said, it's like, okay, can we survive on one salary? Can we survive on a nursing salary? And so we're going to sell our home and move to a smaller home that we could afford just on one salary. And so we were going through all that. During that time, I was working in, I think I might have mentioned, military healthcare. So I was the COO of this military healthcare program. And I was told I was never coming back. So I resigned. I went to the CEO. I reached out to the CEO and I said, I can't do it. And it broke my heart because working with veterans and active duty family members meant the world to me because of my family's, not mine personally, but my family's involvement in the military. And I remember saying goodbye to my team. So my bride reluctantly drove me to my office so I could walk and say goodbye to my incredible team, nurses and doctors and other people, many of them veterans themselves. And I remember I was sitting with this one nurse, and we were talking, and she and I'd worked closely for a number of years together. And she came around her desk and she got on her knees and she held my hands and she said, "Tommy, this isn't the end." She said, "Tommy, this is just a detour. You're going to come back." And that meant the world to me. And that was a bright spot in the darkness. And then I don't know, remember if it was actually at that time or a couple of weeks later, she said, "You got to go see Greg Thompson. You got to go see this doctor. He's incredible and he's going to help. He can help you." And again, I was done, but yet, like you said, I didn't want to leave my family burdened. So I said, okay, let's give it a shot. And this doctor it was different. It was different than any other physician I've ever seen or ever worked with. I remember immediately he included my wife, my bride, who's a nurse, as part of our care team. In most cases, my family was excluded. I remember sitting with him and we talked about physical, mental, emotional, and spiritual aspects of my health and healing. Here's a physician trained in evidence-based medicine talking about spirituality to someone who thinks they're going to die, who had given up in many, many ways, that yet had that one last string that didn't want to hurt his family. And I remember we set game plans. And so he was this caring, loving person, and he developed a relationship with my bride and I, and we were all part of this care team, and we had external providers as well, part of our care team. And he was very tactical, strategic and tactical. He said, okay, here's the game plan. This is what we're going to do today, and this is what to expect for the next 3 days. And if anything different than this happens, you got 3 options. 1, right to the emergency room. 2, call me. And 3, honestly, I can't remember what the third one is at the moment. And it was just this amazing. He cared about us. He loved us. He was smart. He balanced evidence-based medicine with the emotional and spiritual aspects of care. We individualized together my care path. And, it was just, number one, I had hope again. I had hope again because someone cared to actually share time and talk about all those different things. And then again, because the care path wasn't, this is what the average person based on the research should get. It was, yes, here's the research, and here's Tom, and you're different, like everyone's different, and here's what we're going to do. And he also used like a QI approach. We got to root causes of what was happening as opposed to just Band-Aid and drug and those types of things. And again, I relied on faith and hope, and we eventually got through, and I got back to work and was able to learn from these experiences and try to help others.
So I am amazed by this experience that you had with this physician, and I'd like to talk more about that. But first, you never did have the heart transplant, is that correct?
That is correct.
Okay, so you managed to heal and never have a heart transplant. And this doctor helped you to do that?
He did. Again, we found what was right for me. And again, what's right for everyone is different. This is the whole, population health. Yes. Individualized patient care. Yes. It's a both and. Oftentimes what I hear is it's all about the population health. Yes, it is. But you also have to customize that to the individual. I was blessed to be to lead a research institute after all this happened and bring a lot of what my journey was to inform a lot of that work, but also learn from so many other brilliant people. And what I learned in that is much of the research is based on the average male. Well, not half the population is not male, and no one's average. And
exactly.
Please
don't call me average.
Yeah, exactly. So if we think about, even when we think about today, evidence-based medicine, well, we got to be very clear on what we mean by that. It needs to be the best of the best evidence, and it needs to be customized to the individual because everyone's different. And now you add to that the socioeconomic conditions and the health literacy situations and so much more.
Right.
Again, by the time we get to what that care path needs to be for that individual, it may be very far from what we initially thought it was going to be. And that's what Greg Thompson, Dr. Thompson, and myself and my bride and my entire care team did, was we found what was best for me.
Right. And that makes such a huge difference. And it brings back memories of when my mom was diagnosed with pancreatic cancer. My parents were more old world. They were first generation Italians. They hardly ever got sick. It just wasn't on the agenda. Right. So then my mom started having symptoms, and her longtime physician diagnosed her and told her she had 6 months. And to a person like my mother, the priest and the doctor were never wrong. Okay.
Mm-hmm.
So it became a self-fulfilling prophecy. And that's really one of my pet peeves with medical science, because just as you spoke about, that's the average. They're following statistics, and they're taking all these statistics and they're averaging them out. We took her to Sloan Kettering in New York City, and the doctor there was younger and far more progressive. And I clearly remember we were all in the room, and he was actually down on one knee in front of my mom and saying to her, in reality, we don't know how much time you have left. Could be 6 months, could be 6 years. But she wasn't buying any of it because the seed had already been planted. It was almost, you could almost see the glazed over look on her face where she wasn't even paying attention. All she could focus on is, I've got a lot to do in these last 6 months. So I have personal experience with what you're talking about. And I call that the planting of seeds, or technically I call it the planting of weeds. Okay, if we're going to plant seeds, let's plant some beautiful seeds. Give that ounce of hope. Could be 6 months, could be 6 years. We really don't know. So, let's talk about both ends of the spectrum. So I totally relate to that part of your story. And in a previous conversation, you and I talked about the technology being used as a tool. And so this is part of what you're talking about, this part of the technology, right? Is there more you'd like to add to that?
Absolutely. So Dr. Thompson, he used this amazing algorithm to, again, extrapolate together with relationship, with us having hard conversations, with being informed by what we were sharing, balanced with evidence, balanced with these algorithms to come up with, again, what was best for me. So when I think about technology, it's essential, and we must be incredibly mindful. And I always say we must be incredibly heartful when we're using it, especially in healthcare. Because when we incorporate it with intention to enhance and improve relationships and to, again, get to a place that's going to best support care teams and the patients, then we got something special. And yet, how often do we talk to the patient and family and community for what's best? Now, I give a very specific example during the pandemic. So as you know, telehealth, telemedicine has exploded during the pandemic, and that's
Right.
terrific. It's incredible. So I was talking to a physician from the University of Michigan back in 2021, and he was saying, yeah, so he was a primary care doc. He said the day prior, he had 15 telemedicine visits scheduled. 13 did not happen. 13 did not happen because we didn't understand the patient in their environment and whether they could actually do it. He had a lot of elderly patients on his panel. They didn't understand how to use the system. So we built this incredible system that was incredibly helpful and helped so many patients. And yet we didn't take into account, to the best of our ability, what the end user, as they say in technology, but that patient and that family really, really needed. So we need to balance all that if we really want to ensure that we're creating the best or leveraging technology in the best way that's going to lead to best outcome. Now, his practice is amazing and he's an incredible physician. So they took care of those patients. They just didn't take care of them how they expected to, which was through
Right.
the telemedicine. Now, I remember back in 2014, I think it was, I was chairing the World Congress Patient Engagement Summit. And there was a fellow, he was talking about big data and technology. And I remember he shared this story about it was how big data was being leveraged to care for patients. He told a story about, I think it was a woman and she was in her 50s and she was moderately obese and she had diabetes and big data they were managing and understanding her symptoms and so forth. Then big data, they found out that she was no longer buying pet supplies from a local store to take care of her dog. And so big data pulls all this information together and found more. I'm giving you a Reader's Digest version. And they have a care manager reach out to her to talk about the diabetes and so forth and talk about how her physician really cares about her and wants to make sure she's okay. And then they bring up, oh, by the way, we noticed that you're no longer buying the pet supplies. And this woman tells this care manager that she knew and she trusted that she had lost her dog. And she was dealing with depression and anxiety and so forth. And so they developed a path to help this woman, when she was ready, adopt a puppy. And then they provided coupons and so forth for food and supplies for this woman because again, the research shows, having an animal and taking care of an animal can do so much for us. It's wonderful period. And from a health perspective, can do so much. And I remember there thinking, wow, that's incredible. It's also kind of scary that who's getting your data and how they're using it.
Yeah.
And what else is being collected and how we could actually use relationship and have that discussion without having to even pull data from a store and what your purchasing habits are to understand what's happening and then use those other mechanisms to help this person, if that was the appropriate case, to get a dog. So again, I think technology is incredible. And when we use it mindfully and heartfully, we can do amazing things and help amazing people. We just need to be very, very careful in that space.
Yeah, that's a fascinating story. I think for most people, getting a diagnosis of cancer has to be among the top 3 worst possible health outcomes. And I would have to say 1 or 2. I would think number 1 is being told your heart isn't working any longer. You need a transplant or else. And I guess if that ranked number 1, number 2 would probably be some sort of horrific accident where your life is hanging on the line. With all of that, taking all of that into consideration, can we talk a little bit about developing the proper expectations around our healthcare system and building relationships with our practitioners?
Absolutely. So much there. One, I'd like to simply mention the Heart Community Collection is an organization I've become part of, and they're incredible. And their focus for the most part is really about congenital heart disease and about children who have grown and the families around them. And they're incredible. And they've created this community of people that care about each other and love each other and helping one another advocate and manage within the system. And it's just an incredible organization. The people I've met throughout the healthcare system, what I've typically found is they're wonderful people and they're doing wonderful things, or they've been burned out by a broken system. And so they started off with this incredible intention and this calling to help others. But we as healthcare leaders now look in the mirror here, have created a system that's really, really broken, that is leading to 1 physician per day in America committing suicide. It's leading to, we talk about the great resignation through the pandemic and so forth. That was already happening in healthcare. It's exacerbated now. It's leading to, I remember when the pandemic was early in its journey, and having having this adverse impact, and we're having parties for clinical teams, and yet at the same time, we're having nurses go from a 4-to-1 patient to nurse ratio to a 9-to-1 patient to nurse ratio. So what we've done as leaders here is worsened a system in many cases. Now, there are some systems that are incredible and they're doing great, great work, but it's the ones that stand out that are making these decisions that are financially driven only. And I was a CFO in healthcare. I get it. And yet we need to be thinking bigger than that. We need to be thinking about how can we care and love our nurses and our doctors and everyone who works in healthcare, so that, number one, because it's the right thing to do, and number two, so that they're best positioned to care for patients and families in the communities. And I remember during my journey, going in for a procedure, and I remember trying to comfort a member of the care team because they were so distraught, because they were the stress on them was so distraught, and I didn't mind. In fact, I felt good about that. I was actually doing something to help as opposed to being on the other end of it. But at the same time, it broke my heart. Talk about broken heart. It broke my heart because the system is doing so much harm when it can be doing so much good. So again, there's elements of the system that are incredible, and we need to fan those flames of good, and this brokenness that we still need to transform. And that's why I talk about we need to take this healthcare system and create a health caring system which cares for everyone in the system, not just the patient, because you can't just do the patient. You need to care for the care team if you really want to best help the patient and family.
Yes. So I want to back up a little bit because I think the average person who is not familiar with our healthcare system, they probably are not aware of some of the things that you just mentioned that are really, really important for people to know. So first of all, you mentioned the suicide rate among physicians. And it's my understanding that the suicide rate among physicians is the highest rate among any segmented population that we have. So, we could say more doctors commit suicide than, teenagers or unwed fathers. So that's, we have to ask ourselves, why is that? What's wrong with the system that is driving these doctors to burnout, addiction, and then many to suicide, which is just heartbreaking. And so I don't think anybody says to themselves, gee, when I go meet this doctor today, maybe I should analyze whether or not he's depressed. It's kind of their job to diagnose us, not the other way around. And then you also talked about how the healthcare system is broken, and I think people need to be aware of that. And so I champion my clients to become empowered patients and question everything. Part of the break in the system is these quotas that these doctors have. And so the average patient appointment is a 15-minute appointment. And so long gone are the days when the doctor knew the patient. They would come to your home and they would say, George, what's going on with the family? And the doctor would actually talk to you about your life, which I heard loud and clear is something you did not get when they were trying to diagnose you in the hospital.
No, that you're exactly right. And a couple points. One is there are many drivers to the physician suicide rate. One of them is moral injury. It's being placed in a position where you can't honor your calling, where you can't do your best for our patients.
Right.
And that's huge. That's touching your soul. You just talked about the productivity requirements. So another term that folks may not be familiar with is RVU, or relative value unit. And so we as patients in healthcare, not only are we often a diagnosis, we're also an RVU. So physicians oftentimes, especially in the past, less so now, it's getting better, they're required to see or generate X number of RVUs per day. So a physician may be required in primary care to generate 30 RVUs per day. That means they're going to be triple booked every 15 minutes. So they're going in, they have this calling to help and to ensure that patients are safe and cared for and loved and so forth. And yet they're required to hit these numbers. Now, just as I don't think nurses and doctors, I believe nurses and doctors truly want to help. I really do.
I do too.
I
They're
believe-
not evil beings. They're just
Not at all.
broken. They're just working in a broken system.
Exactly. I also
Yeah.
believe administrators are the same thing, and they're also in a broken system. And I had an MD CEO of a hospital say to me, "I don't have time for quality because I need to keep the doors open so we can take care of as many patients as possible." It's an interesting perspective, and I'd want to analyze it and analyze it and analyze it. And yet that is the stress and the pressures that are on people that we need to fix. And we need to change it from the financial drivers of healthcare to there's so many different aspects of healthcare. So there's great opportunities. So there's great goodness that we need to fan that flame. And there's great opportunity to help position people to do far better than we're currently doing now. And again, I'm a quote healthcare leader. I'm part of the problem too. So we all need to do better.
Well, I think I would rather call you part of the solution, because that's what you do through your company. Is your mission is to create empathic, compassionate, caring healthcare professionals, right?
It's a nice. I appreciate that, and that is everything I've seen and everything I've done has informed what I'm trying to do now. So we talk about, again, generating RVUs. I was part of building financial models that led to that. We now are trying to get to what they call value-based reimbursement. I used to develop quality-based incentive programs back in the 90s. It's the same thing, just they changed the name because consultants can make more money when you change the name of something that you've been doing for 30 years. The intention there is to reimburse based on quality outcomes. And so I think it's better. We still have a long ways to go.
I love that. Quality outcomes. Yeah. I wish we had more of those. I hear, of course, in the work that I do, I hear so many horror stories. So if someone was recently diagnosed with a chronic health condition, what advice would you give them in order to help them be an empowered patient?
The reason I'm hesitating is because as someone, again, before I got diagnosed, or even right after I diagnosed, I figured I had it. And so it's very easy to say, oh, do X, Y, and Z. When you get diagnosed, things change. So I would say, first of all, for any of us and all of us, really identify, even before we're diagnosed with anything, really identify who is your care team, who is your support team. And for me, I'm blessed to have a bride that's amazing, and she happens to be a nurse. Also, I wish I had taken more time investing in searching out for the right primary care physician, as an example, and what is best as far as my care team for me, what that looks like. Now, it can be incredibly leaning, or could lean towards Western medicine or not. Follow the evidence there, follow the research there. Really identify ahead of time, be proactive, and find those people that love you, care about you, and you can trust, so that when and if something, God forbid, happens, you can lean on them, because you're going to need to lean on them. You need to have that team. I had my bride, and that was pretty much it until I found Dr. Thompson. I remember when I was going through the major aspect of that illness, and I remember being in the emergency room and hearing, your cardiac enzymes are elevated, your ANA is whatever it might be, your CBC with diff. I had no idea what they're talking about.
Right.
And I'm looking to my wife because they're not explaining it. And I'm looking to my wife and saying, what does that mean? And what does that mean for me? And so we need to best position the patient and family and that care team. And we need to best position nurses and doctors to have the time and for them to be whole and healthy, so that they don't have to be so quick, and they can take the time to explain. I remember coaching hospitals and health systems and people within it, and how important that explanation is to patients, and how we need to say it and say it and say it and say it in all different ways and in different languages and in different, using different forms, be it technology or verbal or whatever, or written or whatever it might be. So I think there's just so many aspects to it. But I also know that's part of what you do with your clients, and I just think that's so incredibly important.
Yeah, I encourage them to do a lot of research and always make a well-informed decision. And keeping in mind that, as you and I have mentioned here today, I would say the majority of doctors have very good intentions, but they are working in a rushed, broken system. So it's really important for the patient to do your research and be prepared to ask questions. What is the long-term side effect of this drug? What is the long-term side effect of my condition? Is there anything that I can do with diet and exercise that might improve my situation? I was fortunate in that my primary physician, he was an internist, and he had so much empathy. And I remember, just him holding my hand while I cried. Because it took 2 years to get a diagnosis. And then I had this whole team. I was being treated at a research center. So I had this whole team of doctors that needed to be managed, and he helped me to do that. So that's what I recommend to my patients. Find a doctor who is empathetic and compassionate that can help you manage your team. I wasn't married to a nurse, so I didn't even have a girlfriend that was a nurse, so I didn't have that advantage. But I'm known for doing my research and that experience. When I spent 7 years in the system and they couldn't get me well, I said, okay, that's I've had enough here. I need to take action. So that's what I encourage my clients to do. And my doctor and I had a deal. If it might help, but would not hurt, there was no way it could hurt me, but it might help. He always gave me permission to try it. And I know doctors are limited on what they're allowed to recommend. If it hasn't been peer reviewed and all that good stuff. But so he was open to that. So he encouraged me to try a lot of things that might help, but would not hurt me. So that was important too. And that's another question I would highly recommend people ask their physician. You say that compassion, empathy, and love helped you to recover.
Yes.
Tell us more about that.
Absolutely. And before I do that, I want to hit on what you just said as well, because during my health journey, I remember I had an invasive, and I didn't have a heart transplant, but I had an invasive procedure, and it didn't work. And I remember after the fact, my primary care physician saying to me, "Oh yeah, well, it only had a 10% chance of working anyways."
Oh, wow.
So to your point, knowing that, now, of course, again, I'm in the throes of fear and desperation and so forth, and my wife was in that space too. And so we didn't ask that right question. So you're spot on around that.
Yeah.
The other piece to complement what we're talking about here is the whole piece on research and evidence. So John Ioannidis out of Stanford has done a ton of studies on studies. And what he's found is that when you take all of his data together, about half, and the Institute of Medicine says the same thing, about half of the evidence that's out there is wrong. It's not replicable. So even if we think that something's evidence-based, there might have been a study or a couple of studies, but not beyond that to really substantiate what we're doing in healthcare. So that's about 50% of what we're doing in healthcare, even if we think it's quality and evidence-based. So we need to, again, patients need to be aware of that. So we can have physicians that are best intentioned, and I think they all are, and yet the information that they're providing to us may not always be accurate. So I wanted to share that. But to one of my favorite topics around compassion and empathy and love in healthcare, how it helped me heal. So I like to reference again. I used to work in a research organization. I have a research background out of Johns Hopkins. There's a ton of research on love in healthcare. And Peter Pronovost actually shared some of this information. I remember I really like the term he used. He talks about loving micro moments in healthcare and what the research says around these loving micro moments. And it's those opportunities that our caregivers want to have where they can connect with a patient. They can smile with a patient. They can sit with a patient. They can hold a patient's hand. They can listen to understand a patient. The impact of sharing love in this way and being present and in the moment has huge impact on anxiety levels, on the ability to share that tough nugget of wisdom that maybe I was embarrassed, or someone might be embarrassed to share with someone they don't really trust or know or think they care about them. That information comes through, that nugget of wisdom comes through, and they're used as part of the care pathways. And in the studies out of Johns Hopkins, it also finds that these physicians and nurses and other care team members, they also need that type of love. I remember talking to nurses, and they said one nurse was telling me the story about she was holding this mother as the mother's child died in the emergency room. And that nurse needed to go take care of 3 more patients in a very short amount of time. And she didn't have anyone loving on her. And we wonder why people are burning out and the type of harm. We need to develop the models where we can actually, again, share the love for everyone involved in the care model. The Schwartz Center out of I think it's Mass General actually does what they call Schwartz rounds, and it's rounding on the care team, just like we would with patients, to share love, to allow these people to process in a safe place, to feel loved and cared about, just like we're asking them to do with patients. And my physician did that with me. He listened, and it allowed my bride and I to talk about some really hard things, physical, mental, emotional, spiritual things that we weren't talking about, that we're hiding, that were eating at our soul in many ways, to lack of a better term. That all came out. So that, again, that all helped to inform us on what was best for me to move forward. Those are the type of care models that we truly need. We need the evidence. In understanding its limitations and its benefits, we need all that. We need all that research. We need the science and the technology. And we need just as much that compassion, that empathy, and love.
Yes, thank you. Thank you for bringing that up. I like to remind my clients and even those I interact with on social media that when medical science says there is no cure, what they really mean to say is we haven't found one yet. Okay, because 100 years ago, which wasn't that long, maybe the age of your great grandparents, there were no antibiotics. So there was no cure for a common infection. So when the doctors tell you there is no cure, just remember that that's not necessarily true. It's just that they haven't found it yet in their pile of evidence-based literature. Linda is with us, Linda Carter. Or Lindy, I'm sorry if I'm mispronouncing that. What you're discussing today is why I became a nurse coach. Thank you for that work, because those nurses need that. And I also had the opportunity to coach with the nurse leaders at my local hospital. And boy, did they need that. I was able to open their eyes and to managing their own stress, because they are givers and they never stop giving to the point where they can become easily burned out. And I actually published a book in that program that I was doing. It's called The Nurse's Pocket Guide, and it's filled with stress relieving techniques for nurses to use. And I'll put that down in the comment section along with your book. We have more to go, and I don't want to take up all of your afternoon, but we have a couple more things to. Okay, so the last time you and I spoke, we had a very interesting conversation about surgery prep. Would you like to speak on that?
Sure, sure. So I've had a ton of orthopedic surgeries in addition to the heart-related surgeries. And I remember I was working for this research institute, and they said, as I was getting ready for one of my surgeries, and they said, you really need to try Peggy Huddleston's Prepare for Surgery. And I had never heard of it. And so I started doing research, and I see that Leahy's done studies on it. Tulsa's done studies on it. Brigham and Women's in Boston recommends this. And what this approach to this prepare for surgery, as it's called, included such things as visualization, relaxation, blankets of love, and healing statements. And I was honestly at that point, I was like, really? I just want the best cutter that there is to fix me. And yet I was open and I went through this process. And again, I was looking at the studies and the research shows that this type of approach lessens anxiety for the patient. It,
Mm-hmm.
from a financial perspective, the typical discharge is 1.5 days sooner. There are cost savings of $3,200 per patient, less Medicaid, 60% less pain medication after surgery if we visualize, relax, love, and share healing blankets and healing statements. And I was just like blown away. And then I did it. And so I had a major knee surgery at that time where they opened it up and they did lots of different stuff in there. One Tylenol I took right after surgery and never needed another pain med after that. And it's just really interesting to me when we think about, again, we always think about the evidence is all and the innovation is all around technology and pharmaceuticals. Yes, incredibly important. It also should be about these types of things. I work for an organization now called the Michigan Center for Clinical Systems Improvement. So in addition to my Dahlborg Healthcare Leadership Group, and we do a lot of work around chronic pain. And we partner with organizations such as University of Michigan, which is incredible. And Dan Claw is one of their physicians there, and he's brilliant. And he shares the evidence around chronic pain management. And he shares that as far as chronic pain management, opioids are one of the last things you want to do if you want to do them at all. And yet, where do we typically go? There. And yet, what's the evidence? What's the evidence starting to show? Tai Chi, yoga, acupuncture, those types of things like the prepare for surgery types of things. So we need to be open to these, what used to be called alternative and complementary therapies. Maybe they still are, but they're becoming more mainstream because now the evidence is showing it and it has incredible outcomes. And Teresa, correct me if I'm wrong. I think you do something similar in this space as well.
I do. And then, again, a lot of what I do is based upon my own journey through the healthcare system, and which lasted a decade. And I went from never having a stitch or a broken bone to going through several surgeries on this journey. And I remember clearly being, parked in a hallway in a surgical gown alone in Mount Sinai in New York City, crying because I had no idea what to anticipate with this surgery. And so based on my own experience, I said, people need to go into that calm. And so I actually did this with a client within the past 6 months who was going in for heart repair. And so the first thing I asked was, how much faith do you have in your surgical team? And the answer was 100%. So that was good. We got that cleared out, because that's a pretty important part. And then we started talking about the outcome. And when I asked about the best possible outcome, I saw the client's eyes kind of roll up to the left and start to think about it. And they laid out for me what they thought was the best possible outcome. And sure enough, they got out 2 days early, just like you said. The pain was minimal. It was just magical what surgery prep did. So yeah.
Absolutely.
Yeah. So I recommend that. And I also, just going back to, putting your team together, when I first became ill and I went to my family physician, and asked for a complete physical. He couldn't find anything wrong with me. And so he sent me for, he handed me antidepressants and sent me for stress management. I didn't know any better. I filled the prescription, took the pills, and I went to this man for stress management who turned out to be a psychologist. But you know what? I stayed with him. I stayed with him because everybody and anyone who's listening who has a chronic health condition that requires ongoing treatment, like we're talking about, everybody needs somebody that they can just say anything to. Yeah, you know, like I'm sure you didn't want to say to your bride, I love the way you refer to her. That's so nice. I'm sure you didn't want to say to her, I'm afraid I'm going to die. Now, maybe you were okay saying that to her, but there were probably things that you didn't want to burden her with. That having an outside party like a coach or a therapist or a counselor is really important. Wouldn't you agree?
Oh, absolutely. And in fact, my care team expanded and expanded and expanded as I got to know and trust and again follow the evidence. And I'll give you an example now. There is someone that we love dearly who is seeing this amazing shaman. This shaman's name is Lisa Solis DeLong, and she has this incredible story of losing a child, and she's clinical. I believe she's an RN, and she's also a shaman. And so she taps into again the clinical expertise and also the shamanic work to help this person get to where they need to be. And this person was having some real challenges. And so again, it gets to the point of we're all different, and what's going to resonate for us and what's going to work for each of us is different. And also lends me to that place of this is also the difference between coaching tactics and true love and empathy and compassion. If we're just coaching tactics, and that's what I used to do, I coach tactics without the other side of it. Well, it's many times it's to check the box. It's not how do I establish relationship and connection and love? How do I ensure humanity is in the healthcare system? And again, the vast majority of people in the healthcare system, they want to be in that place. They're burning out, they're tired. And again, I'm talking about leadership all the way to the frontline people. They all want to be in that place of doing that goodness. And we need to get back to that. Tactics are easy. We can check the box with tactics any day of the week. But if we don't truly have that heart behind it and create the systems which allow all of us to engage our heart in this space, then we've really missed the boat. And so when you have those people that are engaging their heart and understand, again, processes and systems and so forth, like the Lisas of the world, like the people that, like you, and like the people you are also referring to, then we get something special. So I have a naturopath that I use to help me understand what nutrition is best for me. Now, a naturopath may not work for somebody else, but this person, the research and the evidence shows what we're doing together. It makes a difference. And my N of one, it works. And it's kept me healthy for many, many years.
Yeah, it's important. I take all of my clients as the individual that they are. And so we will discuss alternative therapies. We'll discuss diet, nutrition. Healing requires a well-rounded approach that includes far more than medical science. And naturally, if you tell me you have a fear of needles, I'm not going to recommend acupuncture, right? But there are so many alternative therapies out there today that even if it helps us 1%, we're still moving in the right direction. So it's important to investigate all of those avenues. So as we begin to wrap up, this experience is what led you to start your company. Is that correct? To take healthcare to health caring. Yes?
That's exactly right. That's exactly right. And again, it goes back to that both and. So I have a QI background, a research background. I'm very much about the evidence and about the importance of the love, which the evidence shows. So you also the importance of empathy, the evidence shows. So it's not like one's evidence-based and one's not. They all are. And we need to ensure that we're instilling all within the system and creating the system which allows us to all live in that space. And so based on everything I learned through my own journey as a patient, based on everything I've learned as my journey as a healthcare leader, and also many other stories. And I love hearing stories. I write people's stories. I like stories about people when they share with me and what they're going through. And it's really important that we do so. So yes, so I created Dahlborg Health Caring Leadership Group to ensure that we're focusing on relationship-centered care, that we're focusing on relationship-centered leadership within that, that we're focusing on patient engagement and experience, and we're understanding that oftentimes what I see is patient experience is all about marketing and market share. Patient experience needs to be about quality and outcomes. And many organizations do it right, and others, again, are using it to drive financials. We need to focus it on the quality and the outcomes, which, by the way, will drive financials. But we need to make sure we have it in the right order.
Right.
And I do a lot of work also because when we're stressed, when we're fearful, a lot of times our behaviors are not the best behaviors. A lot of times that bullying that I do a lot of work with children and youth sports and so forth. A lot of times that bullying behavior and those things are coming out in healthcare. So I work with a lot of healthcare systems about addressing those things and helping folks in that space. So it's really been a passion of mine, and I work hand in hand with my bride, who's our chief joy officer, and she does a lot of work in self-caring, because if we really want health caring, we need the self-caring as well. And
Right.
so we partner in that space too.
Right. I think that the self-care has to be the priority because everything else is built on that. And that's what so many of the nurse leaders that I worked with needed to get a better grip on, because at the end of the day, we teach people how to treat us, right? And so if your kids and your grandkids and your spouse know how to get what they want from you, they'll tap into that. Oftentimes subconsciously. It's not intentional to cause more stress in your life. It's just patterns that have developed over the course of time. So it was fascinating to watch these nurse leaders recognize that they had these patterns and that they could retrain, and start developing healthy boundaries and retrain those who they love, how to treat them and what was acceptable and what wasn't. Your mission seems overwhelming to me just hearing about it, because it's a huge healthcare system that we have. And, I of all people, thank you for your work, because I know how needed it is.
Oh, thank you. I appreciate that. And, we have such an opportunity to help others, and we just need to take that opportunity. And my bride will say to me all the time, because I feel sometimes that way, that overwhelm. And she says, "But you helped that one person, or you learned today how to help another person," and that has a ripple effect. And I love what you do, and there are so many great people in healthcare doing so many good things. And every time we each do something to help make things better, that's just it's gonna grow and grow and grow. So
I love that.
I'm
I
glad
love
we're all
that.
together.
Yeah. Would you tell our listeners how they can reach you?
Sure, two easy ways. One is dahlborghlg.com, and that's where you'll hear all about the health caring work we're doing, and also work in the children's space and helping children, really helping to amplify positive childhood experiences for children and to address the adverse childhood experiences so many children are having. And then also email tom@dahlborghlg.com.
Okay, and I'll put your website address in the comment section to make it easier for people to find. And I would love to have you back to talk about this work that you also do with children, because it holds a very special place in my heart. So many of my clients come to me with unresolved childhood trauma that has turned on the fight or flight response, and they've lived with the fight or flight response turned on for so long that they are now chronically ill as adults.
Yep.
And so nipping that in the bud, so to speak, is pretty important work.
Absolutely. Absolutely.
So I'm going to extend that invitation to you that we shall meet again and talk about that.
I would love that.
And I thank you from the bottom of my heart for sharing everything that you shared today, your personal story. And I hope that we've helped someone in the healthcare field. And I hope that we have also helped to empower the general public so that when someone does fall ill, and according to the Centers for Disease Control and Prevention, you got a 60% chance that you're going to fall ill, that you'll be better educated now on how to proceed. Is there anything you would like to add in closing, Tom?
I would simply say again that for folks out there, the healthcare system, we have the best of the best people. We have believe it or not, we have the best of the best systems. We need to fan the flame of good, and we need to not be shy about identifying those opportunities to improve and make those things better. Because when one person gets harmed, we all get harmed. And I want to make sure we have a system that meets the needs of all.
That's beautiful. That's beautiful. And going back to the very beginning, I want to close with a piece that was in your bio. Tom believes at the end of the day, it's all about love and impact.
Absolutely.
So with that, we'll close today's presentation. Again, thank you from the bottom of my heart, and we will talk again.
Thank you, Teresa.
It's my pleasure.